Breaking news, we're following. Moderna announces its booster shot provides durable protection for at least 6 months, even against the Omicron variant, but with a lower level of antibodies. The company also says it's advancing an Omicron-specific booster to the next phase of clinical trials. For more on that, I want to bring in a professor of infectious diseases at Vanderbilt Medical Center, Dr. William Shafter, and Dr. Chris Pernell. She's a public health physician and a fellow at the American College of Preventive Medicine. To both of you, thank you very much for joining us. Dr. Shafter, I'll start with you. Are you encouraged by those results from Moderna on the durability of their current booster shot against Omicron?
Absolutely, Wolf. I think it's really good news. We're encouraged. And those data match up with what we're seeing in the field. If you're vaccinated and you've been boosted, we know that you have sustained protection against serious disease that could put you into the hospital. And that's what we've got to focus on. We want to keep people out of the hospital.
We certainly do. Dr. Pernell, Moderna also says that the first participant in its phase 2 trial for an Omicron-specific booster has already been vaccinated. Do you think most of us will receive an Omicron booster, at least at some point down the road?
You know, Wolf, I'm not certain that we will. I think the bigger scientific bang for the buck, if you will, is the news coming around a pan-coronavirus vaccine. While this is welcome news to know that we're sharpening the tools in our toolkit, I think the bigger news will be if we're able to produce that pan-coronavirus vaccine, which would then be effective across multiple variants and other types of coronavirus infections, even those that contribute to the common cold and even SARS or MERS. So that's what I'm waiting on, more importantly.
Yeah, I totally agree. And Dr. Shafter, on that point, let me get your thoughts on what Dr. Fauci said about such a universal coronavirus vaccine, which is likely, at least some experts say, maybe years away from development, but could potentially cover all types of coronavirus. How much of a game changer would that be?
Well, obviously, it would be a great game changer. We know that this vaccine is in the works. It's worked on the laboratory bench. There are very encouraging animal studies, and now clinical trials are already beginning. And this is being led by an investigator, Kayvon Mujarrad, who's at the Walter Reed Army Institute of Research. And along with Dr. Pernell, we're waiting for those results, very eager to see them. Wouldn't it be great if there were a vaccine that could protect us against a whole spectrum of different COVID viruses, even variants that haven't occurred yet?
That would be great indeed. Dr. Pernell, there's good news, at least in a lot of the country right now, heading in the right direction as far as cases being reduced or plateauing, if you will. Do we need to relax restrictions when the virus is waning in certain parts of the country in order to keep Americans on board with public health measures if things do get bad again?
Not quite, Wolf. I think the mistake that we often make is that we relax prematurely. What we need to do is to be consistent pressure on the gas pedal, if you will, because while certain parts of the country we're beyond or past our peak, we're not beyond the peak everywhere in the country. And we're still seeing a considerable amount of deaths. I can tell you in New Jersey, we're still seeing a surge in our emergency departments and our hospitals, even though those numbers are starting to rapidly decline. We may be in a more of a plateau phase of where we will exist for the next 4 to 6 weeks. So I can only caution people just to hold the line and to remain steady. The consistent pressure gets us over the hump, not the quick and jerky changes.
You're absolutely right. Let's not forget more than 2,000 Americans on average are still dying from COVID every day. Dr. Pernell, Dr. Shafter, to both of you, thank you very much for joining us.